I'm Roman, this is Becky, Mari, and Jennifer, and we got Australia for our presentation on healthcare systems.
Okay, the Australian healthcare system provides universal access to a comprehensive range of services, largely publicly funded through general taxation. Almost 70% of total health expenditure in Australia is funded by government. 2/3 are by the Australian government, which is the main one, and state, territory, and local governments contribute the other third. The Australian government is divided into 3 categories, and each one has different roles. First, Australian government sets national health policies and subsidies the health services provided by state and territory governments and the private sector. State and territory governments deliver health services, including most acute and psychiatric hospitals, and they provide community and public health services, also regulate health professionals. And local governments provide environmental control, for example, garbage disposal, clean water, health inspections. They also provide home care and personal preventive services such as screening for breast cancer. The Australian government provides a subsidy of approximately 30% to individuals who purchase private health insurance. Nearly half the population is insured for hospitals and/or ancillary benefits.
Costs are controlled by federal government. Major drivers by cost growth are the Medicare benefit scheme and also the pharmaceutical benefit scheme, which are medications available to be dispensed to patients at a government subsidized price. The federal government considers opportunities to reduce spending growth in the MBS through its annual budget process. The federal government influences the cost of the PBS by making determinations about which pharmaceuticals to list on the scheme and by negotiating the price with suppliers. It also provides funds to pharmacies to dispense medicines subsidized through the PBS and to support professional programs in the wholesale supply of medicines. States are required to manage funding within their budgets. Hospital funding is set through policy decisions by the federal government. The major control is through the capacity constraints of the health system, such as workforce supply. For quality assurance, the National Healthcare Agreement of 2012 ensures quality of care by improving outcomes for all and the sustainability of the system. It sets out national priority policy directions, programs, and areas for reform, such as that of major chronic diseases and their risk factors. The Australian Commission on Safety and Quality Healthcare is responsible for safety and quality improvement. They have developed service standards that have been endorsed by health ministers, such as patient surveys, which must be met by hospitals and day surgery centers to ensure accreditation. The federal government regulates blood supply, pharmaceuticals, and therapeutic appliances. There are also several national bodies that promote quality of care through evidence-based clinical guidelines. They include the National Health and Medical Research Council and Cancer Australia.
Australia has 3 safety nets. The first one is the original Medicare safety net, and then it covers all of the hospital Medicare expenses. The second one is extended Medicare services, and it covers 80% out-of-pocket costs over the annual threshold, which includes senior citizens, low-income caregivers. And the third one is the greatest permissible gap, sets max out-of-pocket fee out of hospital services. The goal is to target the closing gap in life expectancy by 2031. However, their progress is not on track, but they're trying to get on track. The federal government encourages general providers and other healthcare providers to work in the rural areas, and they're encouraging telemedicine to communicate with patients in that area.
One current issue that Australia is facing right now in their healthcare system is the access to a psychiatrist. For every 100,000 people in Australia, there's only 18 psychiatrists. So for them to solve that, they're trying to make psychiatry a profession of choice at the college level so that they can resolve the shortage of psychiatrists. In my comparison chart, I have life expectancy at birth, age and age 60, and it seems like Australia's life expectancy is higher for at birth and at age 60. And on mortality rate, it seems like in the United States, people die more infants die more than in the United States than in Australia. Same for maternal mortality rate. And one chart that I found interesting in the mortality study is that the population using improved drinking water in a percentage from 1990 to 2012, Australia is like 100% clean drinking water for everybody, but yet in the United States, it went from 98% to still to this day 99%. And that's our presentation.
Dang, I really like